Are you out of the woods when it comes to vaccines now that you're all grown up? Which vaccines do you still need as an adult? I'm a nurse. Let's talk about that. If you're an adult and you're wondering which vaccines you should be getting, this is the video for you. As we get older, we certainly don't want to stop taking care of ourselves, and that includes getting the right vaccines. In this video, I'm going to talk about which vaccines you might still need to get now that you are a grown-up. Now, if you've had your childhood vaccines and you're an adult, you may be out of the woods on a lot of these, but there's a few that you definitely need to know about. The first is the tetanus booster. You see, we have this idea that if you get a tetanus shot as a child, you're pretty much covered for life. That's not quite true. We recommend that you get a tetanus booster every 10 years or so. And the easiest way to remember that is to think about the letter T in both tetanus and the number 10. They both start with a T, and you get a tetanus shot every 10 years. The next vaccine that you may need to get is the hepatitis B vaccine. Now, you may have gotten this as a child, but if you haven't, it's recommended that adults get vaccinated against hepatitis B, especially if you're at risk for it. What does that mean? Well, if you're having unprotected sex, if you use intravenous drugs, if you have chronic liver disease, or if you're getting a kidney dialysis, you're at higher risk of contracting hepatitis B. If any of those things describe you, then you should get the hepatitis B vaccine. Next is the HPV vaccine, the human papillomavirus. This is a vaccine that we typically think of as a teenage vaccine, and they can get it as early as age 11 or 12. But if you didn't get it then, you can get it as an adult. It's recommended that you get 2 doses if you're an adult and you haven't gotten the vaccine already. The HPV vaccine helps protect you from certain types of cancers, including cervical cancer, anal cancer, and certain types of throat cancers. And what about the flu shot? Should you be getting that as an adult? Yes, absolutely. Every single year during flu season, it's recommended that you get a flu shot. And you can do that as an adult. It's never too late to start getting the flu vaccine. Now, this is not an all-inclusive list. There are other vaccines that you might need depending on your lifestyle, depending on your work, and depending on your health conditions. But these are the 4 big ones that most adults need to make sure that they get. I'm a nurse. I hope this helps. And remember, take care of yourself because you're worth it.